COVID-19 infection rates are falling in Pakistan, but the virus has created a black market for patients trying to obtain blood plasma from those who have recovered. Michelle Muhyiddin investigates.
Hamad Ahmed works as a tea vendor in Islamabad. In April, he tested positive for COVID-19. When his condition became severe, his family turned to an unconventional form of treatment.
जमा तबीयत ज़्यादा ख़राब शो या जमा फैमिली वाले की सर पर या डोनर दा को जमा फैमिली के सलाह ओकड़ पाई और डोनर दा को पाई पाए जमा इलाज वो शो बराबर शो उसी या बराबर है नन अस्पताल तरागले मा टेस्ट कॉल दोबारा शी कोरोना मा तस्टरे कनिष्टरे नखा जमा तबीयत खदे बराबर है.
Convalescent plasma therapy, which involves the transfusion of the blood of a recovered COVID-19 patient to another infected person, is growing in popularity in Pakistan as the South Asian country battles the virus. Pakistan has recorded more than 280,000 cases of COVID-19 and more than 6,000 deaths since the outbreak started. Selling blood and paying donors is illegal in Pakistan. But blood is in constant short supply at Pakistan's hospitals, so patients and families often turn to alternative sources. As the COVID-19 outbreak worsens, this trade has taken an ugly turn. Blood donors who can prove that they had COVID-19 are allegedly charging hefty sums of money from willing buyers. Screenshots of text message exchanges between alleged buyers and sellers of blood plasma are circulating on social media, sparking public outcry. In an economy hit hard by the pandemic, the black market for blood plasma becomes a lifeline for many cash-strapped workers, where a bag of blood can be sold for a price equivalent to a year's wages. The rampant, unregulated transfusions have health experts worried.
When you talk about black market, usually it is done in a rush, and given that anybody who has a family member who is in ICU in critical care, I highly doubt that they will have the time to cross-check and to test the donated plasma for all these contagious diseases. So in my opinion, and particularly in opinions of many doctors, obtaining blood products from black market is absolutely not a good idea.
The government has advised people not to pay money for the purchase of plasma. It is also setting up more centers for the collection of blood plasma through proper screening.
पेशेंट कोरोना का जो भी पेशेंट होता है वो सारे लैब का यही प्रोसीजर है कि उसका 2 टाइम टेस्ट करते हैं. अगर टेस्ट उसका नेगेटिव आ जाए तो तभी फिर आगे फर्दर उसका स्क्रीनिंग करते हैं. स्क्रीनिंग HbS, HCV, HIV उसका नेगेटिव हो तभी वो अपना ब्लड दूसरे पेशेंट को डोनेट कर सकता है.
It's a lengthy process that many patients could not afford to go through. And with the economy struggling under the weight of the pandemic, poverty and the infectious disease are likely to push more Pakistanis to the black market for a quick remedy. Michelle Muhyiddin, CNA, Islamabad.